segment is sponsored by Intermountain Healthcare and the Utah Department of Health.
All right, whether it's skiing, soccer, or another sport, female athletes are 6 to 8 times more likely to suffer an ACL tear than men are. Mary Nichols explains how biomechanics is helping to reduce the risk of injury.
This is going to be helping the athletes who are not yet injured to reduce the risk of injury.
Whether you participate in sports competitively, recreationally, or on the weekends, there's always a risk of injury.
Anybody participating in a running, cutting, or jumping type of activity, and that includes skiing as well.
Athletes between the ages of 15 and 27 are at the highest risk of tearing their ACL.
Of those folks, of highest risks are females.
Clinical researcher Bill McDermott says at Tosh they're using a sports injury risk assessment to identify knee injury risk factors.
We look at very specific movement patterns. When somebody comes into the lab, we can identify risk factors.
They can then focus on the modifiable risk factors such as risky movement patterns and lack of strength in key stabilizing muscles.
We can prescribe an intervention, whether they go home on their own or do it as a team, or come to one of our training programs to mitigate those risks.
How an athlete moves in the lab transitions to how they'll perform out on the field, court, or slopes, both in regards to their risk of injury as well as overall performance.
These kinds of assessments not only give us a lot of information about an injury risk and allow us to reduce that risk, but these are the same kind of assessments that go towards better performance.
Mary Nichols for Check Your Health.